So now we will perform the sensory examination for the spinal cord injury and Asia classification. So we will be doing for light touch and for pinprick sensation. First we'll ask the patient that if he is able to feel the touch on his limbs, and we'll have to compare it with the gold standard. So we'll make the patient feel the cotton and the pinprick on his cheeks or his forehead as well, for the comparison of the touch to the upper and the lower limbs. If the sensation is equal in the limbs and the cheek or the forehead, that means the points are 2. And if the sensation is less on the limbs or there is some paresthesia in the limbs, that means the point we give is 1. And if there is no sensation at all, that means the points are 0. So it's a 3-point scale for grading the sensation. So at first we'll show the patient that we'll be touching the patient with a cotton wisp for light touch, and then a pin for a pinprick sensation, the sharp end and the dull end. Both of these we will be testing with the patient. So first let's go ahead and test the cotton sensation, that is a light touch sensation. So first I will tell the patient, I will show the patient that I will be touching the patient with a cotton wisp, and then I'll tell the patient that I will touch this on his face also, and I'll tell him to compare the touch sensation. Are you able to feel it?
Yes.
Okay. And now I will touch this cotton wisp on his face. Was it equal to the limb? Okay. So once I have done with the light touch sensation, I will go ahead by doing the pinprick sensation, and I will hold the pin in such a way with my fingers that it doesn't prick the patient. I will hold it from the edge of the pin, and then without touching the patient, I will from any other side, I will only touch the pin. Are you able to feel it?
Yes.
Now I will touch it on the face.
Yes.
Feel it? Okay. Now going ahead with the blunt part of the pin. Able to feel it?
Yes.
Are you able to feel it?
Yes.
So now once the basic part of the examination has been told to the patient, we will tell the patient to close his or her eyes, and then we will start with the dermatomal examination for the sensory part of the spinal cord injury examination. Now going ahead with checking the dermatomal examination, at first we will check the C2 dermatome. So according to the Asia system, the C2, all the dermatomes have specific sensory points for which we have to check on the patient. So starting from the C2 dermatome, the point is 1 centimeter lateral to the occipital protuberance. So there we ask the patient to close the eyes, and then we will try to touch the cotton wisp to the patient at that point. If he is able to feel, are you able to feel?
Yes.
Okay. So that is that C2, and we will compare it with the sensation on his face. Is it equal?
Yes.
Okay, that means the points are grade 2 we have given. Now coming on to the C3 point. C3 is the point in the supraclavicular fossa in just the mid-clavicular line. So there we will try to touch the patient and we'll ask the same questions. Then going on to the C4. C4 is on the lateral aspect of the arm, and then going on to C5, it's on the lateral aspect of the antecubital fossa. Then going on to the C6, which is onto the point on the dorsal aspect of the thumb. Then C7 is a point on the middle, on the dorsal aspect of the middle finger. C8 is on the dorsal aspect of the little finger. And then going on to the T1, which is on the medial side of the elbow. And then going on to the T2, which is at the apex tip of the axilla. And then going on to the different thoracic dermatomes in which there are landmarks, like T4 is at the level of the nipple in the mid-clavicular line, and T10 is at the level of the umbilicus in the mid-clavicular line, and T12 is at the point of the inguinal ligament. Now going on to the lumbar dermatomes, so we will make an imaginary line between the inguinal ligament and the medial femoral condyle. The midpoint of this imaginary line will correspond to the L2 dermatome, where we have to test for the cotton, light touch, and for the pinprick sensation. And the midpoint of the T12 and L2 would be L1 on that same line which we have drawn. So now we have L1, L2, and L3 would be on the medial epicondyle of the femur. Going on to the L4, L4 will be a point on the medial malleolus. So L4 will be a point on the medial malleolus. Here we'll check again for the cotton width, light touch, and for the pinprick sensation. L4 के बाद we'll have L5. L5 is a point on the third metatarsophalangeal joint. Going on to S1. S1 is a point on the lateral aspect of the heel. Here we'll check for light touch and pinprick. Then going on to the S2 will be a point posterior in the popliteal fossa, midpoint of the popliteal fossa. S3 will be a point here, just proximal to the gluteal fold, that is at the ischial tuberosity. And S4 and S5 would be 1 centimeter lateral to the anocutaneous junction. Hence, we completed all the dermatomal points in the patient and our sensory examination, both for light touch as well as for pinprick sensations. And we'll grade these sensations from 0, 1, and 2. And at last, we will make a sum of all the numbers that we have checked on the patient. And further, we'll grade the patient on the Asia impairment scale, which we'll learn in the further videos. Thank you.